What was your hypothesis on what you were looking to find out?
Yes, we wanted to look at a model which is called integrated student supports, which goes beyond kind of the traditional notion that you can tutor kids into school success. You really can't, because kids have other issues that need to be addressed for them to be successful in school. They may need health supports, they may need emotional supports, they may need to improve their behavior, and all of those things can undermine their educational success. And so the notion is to help them in or through the school to be able to do better by addressing these other issues.
School is more than just your ABCs, is it not?
Well, succeeding in school is more than just your ABCs. You know, if a child can't see the board because they need glasses, then someone has to make sure that the child gets glasses. If the family is homeless, then someone needs to help the family find stable housing so the child can do well in school.
Tell me a little bit more about the programs that you looked at specifically and what you found.
The integrated student supports programs are popping up all around the country. They have different names. Sometimes they have no name at all. They just have a smart principal who understands that kids cannot do well in school unless their other needs are being met. So the goal is always to help kids do well in school, and these are now understood, not by everyone, but by most people, as essential to helping them do well in school.
Is there a grade range or an age range at which these programs start or are targeted?
These programs are sometimes done in elementary school, and they go all the way through high school. These programs are now in every state in the country, and they're also included in the most recent education law passed by Congress. They are recognized and supported.
Give me a few details about programs that you looked at. What made a successful program?
The programs that seem to work use data. They use data to identify the problems that need to be addressed and to track children over time to make sure they're getting the services that they need or that their family needs, and that they are in fact doing better. They also have a dedicated staff, someone in the school who really takes charge of this and makes sure that kids are not lost.
What are the implications for having attention, first of all, a focus on these programs?
We did an initial report a couple of years ago, and this is really, updating that report. In between those times, this model was recognized in the most recent education bill. And there are some resources for states to use to encourage the implementation of integrated student supports. So there's really a very important broadening of the understanding that children need these kinds of supports in order to do well in school. I think another important characteristic of successful programs is that they're student-focused. So they're not about the school, they're not about the teachers, they're not about the staff. They're about the child, the student, and helping the child to do better, to have their own individual needs met. You know, one child may need something and another child needs something else. And so you want to make it very focused on the needs of that particular student. There are some where the evaluation, there's some programs that have been found to be effective in their evaluations. Some of them have been rigorously evaluated and found to be successful, but I think we're really still working on why they're successful. You know, what is it about the quality or the services or the staff that makes one program successful and another less so?
From a parent's point of view, obviously you want the best for your kids. If you'd like them in one of those programs, what would a parent look for?
A parent would look for a principal and staff who understand that children's needs are not just met by drilling them and tutoring them, that other needs need to be met.
The programs that you looked at, were they a wide range of geographic locations, urban and rural? Can you tell me a little bit more about some of the programs?
These programs are offered in every state, so around the country, in urban areas and rural areas. One thing about rural areas is that a lot of the services that are needed are not as available. For example, mental health services are very much an important service that many children and families need, and many small towns do not have the kinds of services that are needed, or they don't have enough of them.
Can you tell me about the measurements, how you can tell that there are these significant benefits to kids from having them in these programs?
Well, ideally, a random assignment study is done, or a quasi-experimental study is done, and it's done rigorously, carried out over time to see whether or not the services are provided, and then whether or not the children are doing better. We've identified 19 rigorous studies at this point in time, and what we find is that across those 19 studies, there are no harmful outcomes. There are some that are positive and some that are what we call null or not significant, but there are no harmful studies. All the others are either null, maybe because they weren't implemented well, or they're positive.
Talk to me a little bit about next steps. What else do researchers need to know about these programs?
Well, there's a consortium forming around the country to better understand how to implement these programs so that they really work. They won't be the same everywhere because communities are different, but what are the core components that need to be delivered, and how? How do they need to be delivered? You know, the school systems all around the country have tight budgets, and so they want to have the services that make a difference and not the ones that don't matter. So that is a real interest between researchers and also people at the school.
In terms of importance for some of these supports, from your studies, have you found that there are some that are more important than others?
I mean, the one thing about students' behavior or mental and emotional issues is that it affects the students' performance and also the teachers' satisfaction, but it affects the school climate. It affects the other kids. When there are bullies in a school, when there are children who are acting out, that affects the whole school.
Is there anything I did not ask you that you would want people to know?
I think parents need to know that this is important. If their family needs something or their child needs something, that it is important and okay to seek assistance. They can go to their school as one resource to get that assistance. The school may provide it in the school, or they may refer them to some agency outside. But they should feel comfortable taking action to get what their child needs.
This is a philosophy of almost paying attention to the whole child. Could you expand on that a little bit?
The whole child model recognizes that children are whole people, that their health can affect how well they can understand and prosper in school, and their behavior affects how well they can do in school, and their emotional well-being affects their behavior. So they're whole people in the same way that we think of ourselves as being whole people, and you can't just focus on addressing one issue.
Is it a change, Kristin, that you've seen over the past 5 years, 10 years, a change in philosophy?
I think that this view, that integrated student supports are important to children's school success, has been spreading. That there was a focus before that suggested that students would do well if they studied hard and if they got the educational supports that they need. And gradually people realized that scores were not improving as much as they hoped, and that it was necessary to address some of these other issues as well.
You and your colleagues had looked at 19 rigorous studies of these individual programs. Over what period of time?
We looked at 19 rigorous evaluations that have been done over the last couple of decades, many of them quite recent.
Conclusion, if there's a takeaway that you would want our viewers to know about your research, about the report.
I think it's important when a model comes up from the research and is supported by the research and it's supported by the evaluations, but it is also arising from the field, from the school, where the practitioners, educators on the ground are also realizing that this is an important strategy. And the very fact that those two streams are converging suggests that this is a really important idea to pay attention to for the well-being of children.
Has it been slow to change due to cost, due to policy, due to any other kind of perceptions?
I think social change is slow. Varies. The reasons probably vary from one community and one school to another. You know, that also is the training of a generation of teachers. You have to reach people with a new idea, and they're already overworked in schools, and now it feels like we're asking them to do more. Of course, in some ways, if you have children who are studying better, they're behaving better, they're not stressed out, their families are supporting their education, it might make the whole educational process work better. But I think that recognizing that takes some time. One of the things that's basic to this approach is the use of data. And that's not something that education schools are teaching. And so you have to find that the data are useful in order to think that collecting all that information is worth your time. You know, they're already very busy in schools, they work very hard, and so it feels at first like you're adding something onto their workload, and it takes some time for them to realize that this is actually a benefit to everyone.
Could explain to me what is the integrated student supports?
It's like a plant, and what does a plant need to grow? A plant needs sun, it needs water, it needs fertilizer. It doesn't just need one thing. It needs integrated supports, if you will, to help it prosper. Integrated student supports are adding on to what schools typically do, you know, teach kids the lessons, by addressing the needs that children have that interfere with their listening and benefiting from those lessons, if it's eyeglasses or if it's a stable home.
Area of expertise?
Adolescents and young adults.
And if you could tell me where you did your undergraduate work, master's, and then advanced degrees?
Yeah, I was an undergraduate at the University of Minnesota, and actually I trained to be a teacher. And then I went to the University of Michigan and got a doctorate in social psychology.